This is Dr. Scott Sherr. In this interview, I am interviewed by Boomer Anderson about my life and work as an internal medicine physician in the hospitals, as I call it, the meat grinding ways of a hospitalist physician, turning people in and out, celestial discharges, and at the same time, how I've transitioned my practice to being a health optimization medicine practitioner. This is a foundational health approach, and it's an approach that I truly feel is the future of medicine. We talk about how you can learn in your own practice to be a health optimization medicine practitioner, and how you can find us at homehope.org. Enjoy.
You have an interesting position, Dr. Scott, in the sense that you work in a hospital. You sort of got like the Batman thing going on, right? So by day, hospital doctor, by night, health optimization medicine doctor. So let's talk about those two roles in various contexts. So again, there's nothing inherently wrong with our current medical system. It just might not service the whole continuum. And so when you're in the hospital, the types of people that you come to see you, like they do need help. And,
They absolutely do, yeah.
And so how do you service them in the hospital? And then we'll get in a little bit to your...
Yeah, I mean, I had a colleague of mine, I think it'd say it best, it's a meat grinder. You just churn people in and out as fast as you possibly can, because that's how the system is set up. You can't keep people patients, you can't keep them in the hospital for very long. You have to get them out as soon as you can, and then you're just kind of getting them well enough to get out of the hospital. Sometimes they go home, sometimes they go to a skilled nursing facility, sometimes they celestial discharge, which is when they die.
That is, I heard that for the first time a couple of weeks ago, and I didn't realize it was actually a term.
Celestial discharges are very important and very helpful at times. Not always, unfortunately. But the problem with the conventional system is that that's all it really can do, is kind of put you together enough to walk out of wherever you're going. They're never really looking at the full picture. They're not really trying to help you be healthy. They're just trying, even in the outpatient side, they're just trying to help you prevent early diseases, right? So like they're looking at early onset or early signs of diseases. But what if there was a way to look at everything before all that happened? Or even if you have some of those diseases and illnesses, can you put that aside for a minute and just focus on optimizing your health? And that's when I met Dr. Ted in 2017, and he mentioned to me, he's like, well, if we could just focus on health, what are the beneficial side effects that you could see? You could see their energy that get better. You can see their infections, their brain fog, all these things get better. And I was like, well, why don't we do that more? And then the nonprofit was his design to create more practitioners like you and now and me, of course, and create this way you can create a foundational health focus, and then it's not mutually exclusive to anything else that you would do. You still need to go see your primary care doctor, you still need to get to the hospital and go to the ER if you have an emergency, but if you have a foundational piece of that, then everything else is going to be easier. And that's what I've seen in clinical practice over the last several years.
So you go home from the hospital, you put on, are you Batman, Spider-Man, what type of person?
I just wear scrubs.
Okay, so but you have to change out of your scrubs into your Spidey suit.
Yeah, sure.
And you put on your Spidey suit, you're a health optimization medicine doctor. You have clients that come to you with various in various shapes and sizes, right?
Sure.
And so talk to us a little bit about those shapes and sizes, because I know, for me, I generally work with like almost strictly entrepreneurs at this point.
Right.
But you see a variety of the population. What do they come to you looking for?
So most people are looking for a solution to a problem. Most people have an issue that they want to solve. And so it's an education to say, look, I understand you have this problem, you have this condition. It could be something as small as a knee injury or as big as cancer or something else. But the conversation always goes back to the foundational things, because if your immune system doesn't work, if your mitochondria don't work, if you have poor amino acid function, you can't make neurotransmitters, nothing else is going to work. And you can't, and as a result of that, if you don't focus on that stuff, nothing else is going to get better. And so if you have a cancer, oftentimes cancer is because of immune system dysregulation. And so if you improve immune system function, maybe that's going to help them. So I always take the condition aside, leave it aside and say, look, this is important, but it's not our focus, because we're going to optimize your health, and then everything else is going to go from there.
Beautiful. And it all starts with the basic cell, right? And so you're optimizing the cell. You do nutrient and hormone balancing with some of your clients 6 to 9 months later. But in the meantime, you have a few protocols for them to really experience wellness quickly. And so, again, let's just close things off here with in short, health optimization medicine in practice, what's sort of a basic way that somebody can look at what a health optimization practitioner, if they wanted to go to one, first, where do they go, and what can they expect?
So I think the way I like to frame it to the people that are asking about the practice and about the nonprofit is like, look, you can have your own practice already. Like, I have a specialty in hyperbaric oxygen therapy, as you know, but I didn't have a foundation to what I was doing. If you want a foundation to your clinical practice that's holistic, that's comprehensive, that's using sciences that are well known, just haven't hit the conventional medical establishment.
And also cutting edge.
And cutting edge, yeah. I mean, then this is the way to go, because the doctor of the future, the practitioner of the future, is going to be able to look at all different types of data and be able to synthesize it all together and do it in multiple different layers. And our layer, I really truly feel, is a foundational one.
Yeah, so whether it's metabolomics, exposomics, epigenetics, chronobiology, bioenergetics, evolutionary medicine, gut immune system, all of those are key components to optimizing that cell and really actually putting somebody on that path to health.
Absolutely.